Welcome, everyone. It's great to see so many people here. We will also be recording this session and it will be available on the UCSF Osher Center YouTube page maybe in a week or so. So if you know anyone who wasn't able to make it to this talk and would like to watch it in the future, that's where they'll be able to find it. So welcome to the UCSF Osher Center for Integrative Health Monthly Research Seminar. My name is Ariana Thompson-Lastad. I'm a research faculty member here and I coordinate this seminar series. Our speaker today is going to be Dr. Rachel Pagones, speaking about revolutionary acupuncture in the United States, history and contemporary legacy. I'll introduce her in just a moment. And everyone is surely very familiar with using virtual meetings. In this meeting, you are welcome to put questions in the chat as we go along, but just know that they'll get answered at the end in the last 10 or 15 minutes. We'll wrap up right at the top of the hour. And if you are not already on the mailing list for this research seminar series, we can share a link for how to get on that. But we do monthly research seminars on integrative health during the academic year, more or less. And our next speaker is going to be on Tuesday, March 25th, and will be Dr. Ana Maria Branceanu, speaking about, I believe, integrative group medical visits for older adults, but we'll confirm. So today our speaker is Rachel Pagones, who earned a clinical doctorate specializing in healthy aging and longevity from Yosan University of Traditional Chinese Medicine in Los Angeles after a master's degree in acupuncture and herbal medicine at Pacific College of Oriental Medicine in San Diego. She currently practices acupuncture at the Cambridge Cancer Help Center in Cambridge, England, and is a research project manager at the Northern College of Acupuncture in York. Rachel is interested in how acupuncture is used to reach people in different settings, partly inspired by her years of involvement at a free clinic in Southern California, which culminated in a qualitative study looking at the perceived benefits of long-term acupuncture for low-income older adults. Her talk today will be related to her book, Acupuncture as Revolution, Suffering, Liberation, and Love, which I highly recommend, and was published in 2021. Welcome.
Well, thank you. And oops, do I need to start sharing my screen again now?
Yes.
Okay, do that. Sorry, everyone. These meetings always seem to start with, okay, I'm going to share my screen now. And there we go. Right, well, let me put it into presenter mode also.
We can see it, looks good.
Yeah, is that in presenter mode? Okay, great. Okay, hello, everyone. Welcome. Thank you for coming. And I would like to thank the UCSF Osher Center very much for inviting me to give this talk, partly because it's caused me to go back and read through all this history again. And A, I still find it really fascinating. And B, it's reminded me just how important the legacy is to acupuncture and its mission and its vision today. My topic is what I call revolutionary acupuncture in the United States. And this started around 1970 in the South Bronx in New York. And it has evolved to where it still exists in some form, some guise today. But to give you an idea of how times have changed and how that sense of revolutionary acupuncture has changed, this picture on the left, that's Richard Taft, a young doctor. You can see he's very young, who at the time was the director of the Lincoln Detox Collective, which was a group of people at Lincoln Hospital in the South Bronx. And they were practicing acupuncture on people to get them off of heroin and methadone. And it was alleged by some people and some groups that Richard Taft had been murdered. That was never proven, but he certainly was found dead in the very early hours one morning in the hospital. And the circumstances of his death have never been proven, or if they have, that hasn't been released. So very fraught times. And then over on the right, you have a picture that was taken from the Working Class Acupuncture Clinic, which is a clinic of the People's Organization of community acupuncture in Portland, Oregon. And they are the holders of what I would call revolutionary acupuncture today. And you can see a couple of portraits there. The one on the bottom is Mutulu Shakur, and the one a little bit higher up on the right is Dr. Michael Smith. And they were both very much involved in those early days, and they're still honored and thought of and referred to by the POCA and other revolutionary acupuncturists today. It's a different sense of revolution, though. Just a brief overview of what I'll be talking about. So again, this is what I call revolutionary acupuncture. And in my book, I posit that there have been 3 revolutionary acupuncture movements in the United States, beginning in the 1970s in the South Bronx, and then continuing in the early 1980s with another acupuncture college known as First World Acupuncture, and then culminated or just continuing today with the People's Organization of Community Acupuncture. But so these origins of revolutionary acupuncture, I'll be talking about some of the influences, including China's barefoot doctors and Mao's medical diplomacy, particularly in Africa, and the role that played in global public health. Then the role of certain groups such as the Black Panthers, the Young Lords, and other leftist movements at the time. And very importantly, the creation of educational institutes, because all of these revolutionary acupuncture movements have had their own educational institute that has been instrumental in transmitting the ethos and the practice. And then the second bit of the talk, I'll go into the more broad evolution of revolutionary acupuncture into what I would call social justice acupuncture. And that tends to involve group acupuncture, largely because group acupuncture is less expensive and it makes acupuncture more accessible to more people who wouldn't otherwise be able to have acupuncture or even know about it. So some of those people are POCA, the People's Organization of Community Acupuncture, ACMAC, which is the Association of Community and Multi-Bed Acupuncture Clinics here in the UK where I live. A couple more acronyms for you, NADA and 5NP. NADA is the National Acupuncture Detoxification Association, and NADA and 5NP are also a 5-point protocol in the ear that is often used to help get people, support them in recovery from addiction and other forms of trauma, pain, and mental distress. And a little bit about HIV/AIDS work, because while that has not really been part of the revolutionary acupuncture movements, it sort of paralleled the development of community acupuncture. And indeed, some of the people who were involved in the 1970s with the revolutionary acupuncture became very much involved with working with people with HIV and AIDS. And then very briefly, I will try to touch on other forms and uses of group acupuncture because there are so many of them. Okay, this is going to be kind of a whistle-stop tour of revolutionary acupuncture in the interest of time, but a brief synopsis of what was happening in the 1970s. So in 1970, the Young Lords, this was the Puerto Rican nationalist group, who were advocating and acting for community control of services in their neighborhoods, and particularly community control of health services. So they basically took over Lincoln Hospital twice in 1970. And Lincoln Hospital was the municipal hospital in the South Bronx. And it was in such poor shape. The services were so poor, everything was so poor, that it was widely referred to as the butcher shop. And indeed, there were two very people who served very different roles at that time. One was Fitzhugh Mullen, who was a young physician at the hospital, and one was Mickey Melendez, who was a young lord and an activist. And they both wrote memoirs of that time, and they both had chapters called The Butcher Shop. So from 1970 to 1972, following the occupations, you had activists, including the Young Lords, other groups, and then some other political revolutionaries, some of whom had been in prison, whether they were political prisoners or otherwise, some who were still struggling with their own drug addiction. And then they began working in a heroin methadone detox program at Lincoln. And I say heroin / methadone because at the time, the accepted and indeed the approved way of getting people off of heroin addiction was to use something called methadone maintenance. And methadone maintenance came with its own problems. One, that methadone is also an opioid and it's also addictive, and people would become addicted to it. And another is that the state was controlling these programs, and people in them had to conform in certain ways to remain in the program. So the activists shortly began using acupuncture. Well, there was a lot of political activity going on, people who were not necessarily palatable to the hospital. So by 1978, they basically they kicked out the more radical activists from the hospital. But not to be deterred, those activists went to Harlem and they opened up a college there. They formed something called the Black Acupuncture Advisory Association of North America. And they opened this college, and they'd sort of been running it while they were in the hospital, but it became a formal college. The political activities, some of them continued by some people, and the college was raided and shut down by the FBI in 1982, and it was really a massive and violent purge. But out of the ashes, some of the people who survived that purge, and by survived, I mean they didn't spend decades in prison, but they formed a new acupuncture college, and they had to put the politics aside. They had to do that. But they were focused on some new things, really, in acupuncture in the United States. They were focused on the right of Black and Latinx people to learn Chinese medicine and other indigenous medical traditions and serve their communities. Now, the background of there was a call for community-based healthcare in urban ghettos. And this came out of some really terrible conditions in places like the South Bronx. And that picture you see on the left, that is of the South Bronx in the 1970s. And you can see it looks like a war zone. Conditions were really bad. But the origins of using acupuncture as a solution to any of this need for healthcare began in rural China. And specifically around 1930s, 40s, 50s, 60s, and into the 70s. And the 30s was even before Mao's era, but at that time they were already doing at least one experiment that was very influential in community-controlled healthcare in a rural community. Back to the South Bronx and revolutionary detox acupuncture. So these two occupations of the hospital in the 1970, the first was in the summer and the second was in November. And it was led by three groups. The Young Lords, something called the Health Revolutionary Unity Movement, or HRUM, which was a group of hospital workers, and they had formed at another hospital in New York. But they were closely allied with the Young Lords, and they were really focused on community worker control, or even just worker control of health services. So they were working to improve conditions in hospitals for workers. And then Think Lincoln was a group that formed specifically at Lincoln to serve Lincoln. It was Puerto Rican people, white people, professional people, non-professional people who were all workers at the hospital. Some of them were community activists, some of them were involved in street gangs, but they were all using a form of direct action to get changes to happen. And this was a very common tactic with activist groups at the time, direct action. So an example of that is one of the first things they did is they set up a complaints table in the lobby of the ER. And patients could lodge complaints there. Workers could lodge complaints there, and they did in great numbers. Another example of what they did was one of the complaints was the doctors are not available. They're taking too long lunch breaks. So some of the activists went down and they found the doctors where they were, and they told them, you're coming back to work. And by one account, at least the doctors did come back. So by 1972, this was what was called the Lincoln Detox Acupuncture Collective, sometimes known by other names. You can see on the picture there, it's Lincoln Detox People's Program. But a collective was the form that a lot of organizations took at this time, and they took collective decisions and collective action. Now, some of the influences leading to Lincoln Detox, because it didn't just come out of nowhere, and it didn't just come out of some activist imagination either. We had leftist political movements of the 1960s, and this was a a loose coalition, or coalition may even be too tight, a loose sort of amalgamation of leftist political movements known as the New Left. And this was sort of where Marxist-Leninist thought had evolved to by this time. So it was less focused on the class struggle and more focused on things like imperialism and colonialism and racism and the oppression resulting from those. Then you have the opening of US-China relations. Nixon's historic visit to China was in 1972 when he went to Beijing. But even the year before that, you had some small groups of scholars and academics and physicians traveling to China to observe what was happening. And they were, of course, they were given a tour of the best things, but among those things they saw was China's healthcare reforms. You also have what was known as the scientization of acupuncture. Now, scientization is kind of a funny word. We don't really have it or use it in English, but it was used very much in China and in Japan. And in the context of acupuncture, it refers to the idea that acupuncture is something that can be understood scientifically. It can be seen to have mechanisms of action. It can be quantified in some ways. And one of the ways this was done was through acupuncture anesthesia during surgery, particularly using electroacupuncture. So that picture on the left, that was taken by Paul Pickowitz, and he was one of the young scholars who traveled to China in 1971 with a group called the Committee of Concerned Asian Scholars. And his group were taken to witness 4 different surgeries using acupuncture anesthesia. And you can see there the little electroacupuncture box, and that's something we still use today, not for anesthesia during surgery so much, but we do use it for certain pain conditions and things that can be very effective. But you can also see that there's a copy of Mao's little red book touching the electroacupuncture machine. So the politics and the scientization were very much wrapped up in each other. Then you have the counterculture, the hippie counterculture, the counterculture that young people embrace, particularly of East Asian philosophies and East Asian practices. And that really amplified interest in acupuncture, particularly in places like California and New York. And then we have a couple of things in red I will talk about in the next few slides. Mao's medical diplomacy, including the barefoot doctors, and the lousy conditions I alluded to in the South Bronx, which led activists to conclude that they were under a state of chemical warfare. Mao's medical diplomacy, this was a way of sort of spreading the communist revolution to the world. And from the 1950s to the mid-70s, that's a period that the historian Julia Lovell calls Mao's revolution in its most expansive phase. And where did they want to expand to? Well, areas where socialist revolutions were taking place or socialist revolutions were about to take place. Places like Cuba and particularly Africa. So the Chinese Communist Party sent medical resources, among other things, to various nations in Africa that were poised for their own socialist revolutions. And this medical aid included barefoot doctors, which I will talk about in a moment a bit more. So for instance, in the newly formed United Republic of Tanzania, they sent barefoot doctors. And then several other African nations were introduced to TCM acupuncture. A TCM, by the way, that stands for Traditional Chinese Medicine. And that was the form of acupuncture, the brand of acupuncture that was sort of distilled and standardized under Mao. Now, the activists in New York, they were very aware of what was going on in Africa. They really supported those revolutions. And the poster you see on the right, that was a poster to support, it was a concert to benefit the Zimbabwe African National Union to raise money for an ambulance. And if you look at the poster, you can see there were some very well-known figures there, Gil Scott-Heron and Nobuko Miyamoto among them. So I don't know that they knew about the acupuncture happening in Africa, but they were aware of the revolutions and the politics, and they were aware that China was very tied up in it. The barefoot doctors were almost surely the most well-known phenomenon of at least of healthcare, to come out of this period of China when China was being open to the West, or the West was deciding to look at China. And people still talk about barefoot doctors today, but there are a lot of conceptions and misconceptions of them. So who and what were the barefoot doctors? Well, they were young people, typically aged 17 to early to mid 20s, preferably before they were married, from suitable backgrounds. And that means they were from the peasant classes, they had at least a middle school equivalent education, and they had correct political thoughts. And these young people were trained in basic principles and techniques of both biomedicine and traditional Chinese medicine. They were often said to be armed with one silver needle and a bunch of herbs. And it's kind of a romantic vision. And indeed, they were often shown in posters, particularly young women, barefoot doctors in posters. But basically, that means that they practiced acupuncture and Chinese herbal medicine. But equally, they used the paraphernalia of Western medicine. They used stethoscopes, they used saline drips, they used antibiotics. And these things came to be really valued and appreciated by the rural Chinese peasants because they had never had access to those things before. But the barefoot doctors were not sort of untrained peasants. They were actually trained paraprofessionals who worked within a structured three-tier healthcare system. And among other things, they were trained to refer out when necessary. And they were not barefoot. They were called barefoot to show their allegiance with the peasant classes. And indeed, they were always classified statistically as peasants, but they did wear shoes. And there were many, many articles about the barefoot doctors written in American newspapers all over in the years after the early to mid 70s. The barefoot doctors also had a really large influence on global public health, not just in the United States, but elsewhere. So I mentioned earlier that some US physicians had begun visiting China as early as 1971. And among them were Victor and Ruth Seidel. And Victor Seidel was the head of the Department of Social Medicine at Montefiore Hospital in the Bronx. And indeed, in the 1980s, Montefiore began its own acupuncture program for the community. But this was before they knew much about acupuncture. And Ruth Seidel was a psychiatric social worker. And they were both very favorably impressed by what they saw of China's healthcare reforms. And they came back and they wrote several publications about it, including, I believe, a book and different articles. And Paul Dudley White was a prominent cardiologist. He was President Eisenhower's personal physician when he was in the White House. And he came back from his visit, and he also wrote an article in the New York Times about his favorable impressions. So you had this phenomenon whereby favorable impressions of China's healthcare reforms, including barefoot doctors, began spreading in the United States and elsewhere. And so I don't know if you've heard of the Declaration of Alma-Ata, you probably have, but it's a World Health Organization treatise established in 1978 that established health as a fundamental human right. And this was really an ideological shift from previously, when it was more of a top-down approach where the so-called developed nations will tell the so-called third world nations or developing nations how to do things. When this stated that the people have the right and the duty to participate individually and collectively in the planning and implementation of their healthcare. And the Barefoot Doctor Initiative is now considered one of the primary forces behind that ideological shift. Jumping back to the South Bronx in the 1970s, and here's another picture, and this was taken by Mel Rosenthal, who grew up in the South Bronx, and he moved away to the city of New York, but he came back. He was a photographer and a teacher of photography, and he began taking pictures of photographs, particularly children juxtaposed against this really devastated background. But the conditions had been sort of getting worse throughout the 20th century. The philosopher Marshall Berman called it herbicide. He said he coined the term herbicide to describe what was happening there. So you had industry being moved out of the city throughout the 20th century. You had the demolition of neighborhoods to build roads and bridges. as envisioned and enacted by the great, and some would have said evil planner, Robert Moses. You had government policies such as benign neglect, which when cities, neighborhoods would start to be in trouble, basically falling apart, the city would just allow them to. Or planned shrinkage went even a step further, where neighborhoods were targeted to see if they were failing. And if they looked like they were failing, they would have the municipal services pulled from them. For instance, call outs from fire departments. So you had this phenomenon known as the burning of the Bronx, whereby at one time it was estimated that 38 buildings a night were burning in the Bronx. And you can see what that looks like. Some claimed it was a deliberate policy. Certainly there was evidence that there were some landlords who were taking advantage of the situation to collect their insurance payouts. Others said that there was some deliberate burning because to get rid of the Black and brown people who were becoming too powerful. But what you had was a massive loss of housing, particularly for poor people, and white flight to the suburbs. Another thing that was happening in the South Bronx was there was what Joanna Fernandez in her wonderful book on the Young Lords says was the highest rate of heroin addiction in the world. But there are other parts of the world that had terrible poverty, large populations, and access to drugs. So what was going on here? Well, the activists came up with a theory, an analysis that they called chemical warfare. And this had begun some time earlier among leftist thinkers and the Black Power movement. And they were linking heroin to the pacification of ghetto inhabitants. So basically, they were saying that the US government and pharmaceutical companies such as Eli Lilly were conspiring to push heroin on the streets of Harlem and the South Bronx and other places. And this was seen as part of the US imperialism and capitalism, just as it was being conducted in other countries in the world. This was bolstered by the revelation of CIA involvement in the heroin trade in Southeast Asia. And this was not just a theory of activists, but this was uncovered by scholarly investigation. Alfred McCoy, who was at Harvard, wrote a book on it, did a lot of investigation, and there were resulting congressional hearings in the 1970s. And the activists, the revolutionary detox acupuncturists, were very aware of this. They read the Opium Trail in their college at Banna. Other activists who were involved read the Opium Trail, and it was also conveyed in newspapers such as the Young Lords Palante. So here's where acupuncture as revolution comes from. It's the idea that these East Asian modes of healing could be used to combat a perceived state of war involving heroin addiction. And these alternative modes of healing were then seen as remediation against the destructive forces of a capitalist society. And this becomes one aspect of self-determination, which supports the goal of liberation. So this fight to heal people from addiction, it's not just about, oh, this poor guy, he's addicted to heroin and he needs help so he can have a better life. This is going to help fight capitalism and colonialism, the very forces that are leading individuals to become addicted. So we have the beginnings of acupuncture detox, or revolutionary detox acupuncture, as I call it. Mutulu Shakur, who you saw on the title slide, and then Walter Bosquet, who was a member of the Young Lords. And they were both young, they were both activists, they were both very involved in revolutionary politics and committed to healthcare as a human right. And they came together at Lincoln Hospital. And they traveled to China in 1977, where they witnessed acupuncture and other Chinese medicine being used. But they had already studied acupuncture and Chinese medicine before this. They had got some formal training from a father and son duo who came from Montreal. And they gained degrees. So they were already practicing acupuncture for detox by this time. And Mutulu Shakur particularly, he was very linked with a lot of different activists. He was friends with the prominent Japanese-American activist Yuri Kochiyama. And he said that it was she who first introduced him to acupuncture in Chinatown. You can see again that picture on the right, that is another of Paul Pickowitz's photos of a surgery taking place with the electroacupuncture in the background and Mao's little red book right next to the patient's head. So again, they were very aware of and interested in the politics as well as the practice. To make a long story very, very short, those acupuncturists were evicted from the hospital in November 1978. Police were sent on the order of the mayor to surround the branch where Mutulu Shakur's people were practicing. And they were dispersed either to far-flung hospitals or they were fired. And Mutulu Shakur left, went to Harlem, formed BANA, and Dr. Michael Smith, who was a psychiatrist, continued at the hospital. And his branch became popularly known as Lincoln Detox, and he continued to work on the ear protocol, but that is another story. So revolutionary acupuncture and education, and this is really important because each one of these movements had their own educational institute, and it's certainly probable that the acupuncture and the ethos and the revolutionary fervor wouldn't have been passed on without it. So we had BANA. The college was popularly called BANA, but formally it was the Harlem Institute of Acupuncture. And this was the first U.S. acupuncture college designed to train and serve Black and Latinx people. Now, First World Acupuncture, after BANA was crushed by the FBI, those people who came out of it, who survived, formed First World Acupuncture, some of them. And this was the first U.S. acupuncture college, and as far as I know, the only U.S. acupuncture college to offer a traditional acupuncturist in service to the community degree. And it's interesting that these two colleges, they didn't have a long life, particularly First World only lasted a couple of years. They did not have large cohorts, but many of the people who were there, if not all of them, continued to practice acupuncture. Some of them are still practicing acupuncture today. And some people who have been very influential in acupuncture and public health have come out of those two little colleges. So it was a very potent time in terms of influence. And in more recent times, we have Poca Tech, which took its first cohort in 2014, I believe. And this is Poca's acupuncture college, and it is the first U.S. acupuncture college designed to train community acupuncturists. So I guess we might say they also have a traditional acupuncturist in service to the community degree. That picture is of the outside of working class acupuncture, which is a Poca clinic in Portland, Oregon. And you can see they have the power salute and those little stars down the wrist. Those represent the heart shen in Chinese medicine. So it's a power fist with a heart. This is taken from the Working Class Acupuncture Clinic in Portland. And you can see it says Ancestors of Liberation Acupuncture. And liberation acupuncture is the philosophical basis of POCA. And its model of low-priced treatments in a group setting has been inspired partly by these early revolutionary acupuncturists. And you can see, again, there's Mutulu Shakur and Michael Smith, and they still honor them today, as well as their traditions. There are some key points of commonality among these three movements. One is that healthcare is a human right. Another is that disease can only be understood in the context of socioeconomic forces. The priorities of people who have been oppressed, exploited, or traumatized by society must be emphasized. It seeks to combat racial and social inequities through acupuncture, and it sees acupuncture, therefore, as a means to engender social change from within. And so there are people who are still trying to do that. And now I'll move on to just a bit about community and group acupuncture today, some of which has still some revolutionary fervor, definitely some social justice commitment to most of it. And these are some of the groups that are involved in it. Just a little moment of group acupuncture here, just to define it, because it can be many different things. So it's often referred to as community acupuncture or multi-bed acupuncture. That's the term they prefer here in the UK. Community acupuncture is also movement, but there are many acupuncturists who are not POCA members and they still practice community acupuncture. And but because it tends to be, it's lower cost, it tries to make acupuncture more accessible, and it therefore tries to reach people who couldn't otherwise be reached by acupuncture. It tends to have this more kind of social justice vibe or ethos. So people can be sitting in different ways. They can be in straight back chairs, they can be in reclining chairs a la Poca, they can be lying on massage tables or other kinds of tables or beds. But they're all in one space. So they might be spread distantly around a big room. They could be grouped more closely in a circle. And as far as how they're interacting or not, that varies too. In some clinics, people talk to each other, and that's a kind of a support. The working class acupuncture clinics, part of their ethos is people have a chance to not talk, so they're silent. I recently heard a talk by a very busy acupuncturist from Taiwan who said that her patients would sit and watch TV together sometimes. So there are many different ways it could be experienced. The National Acupuncture Detoxification Association is one of the best known organizations. And this is an organization, had its origins in Lincoln Detox Collective with our revolutionary acupuncturists, but it was developed further by Michael Smith, and then he and others formed the organization and continued to build on the protocol. But it's a 5-point needle protocol, and 5NP is the same 5-point needle protocol. But this is an initiative by POCA in which they have a program to train and support non-acupuncturists to use the technique in their local communities. NADA trains both acupuncturists and non-acupuncturists to use it. And it's a technique that's really valued for its easy integration in group settings. You don't need a 3 or 4 year degree in Chinese medicine to do it. And it is used for things such as addiction, support and recovery, trauma, and pain. And just a little thing about auricular acupuncture, it's very interesting where it came from. So it didn't actually come from China. It was developed in France by a physician called Paul Nogier, and he had lived in China, had experience in China, but he was in France and he was interested in acupuncture, and he witnessed or heard of an Algerian folk healer, and she cauterized someone's ear to treat sciatic pain. And he was really interested in that. So he studied the folk healing and he studied the acupuncture, and he came up with this system of acupuncture whereby the body is modeled, contained within the ear. It's a kind of somatotopy. And so you can treat the entire system, including mental, spiritual issues, using just the ear. And that was then transmitted to China. Mao leapt on it and was advertising it as one of the great developments of traditional Chinese medicine. And then our revolutionary detox acupuncturists discovered it via a newspaper article from a Hong Kong acupuncturist who was using auricular acupuncture to treat something completely different in his patient, and inadvertently discovered that the patient's opium cravings had been reduced. So the transmission is really interesting. Moving on to working class acupuncture. So POCA is a nonprofit that promotes affordable, accessible group acupuncture. And working class acupuncture is their clinical arm. And POCA Tech, as I mentioned earlier, the primary aim of their college is to provide more acupuncturists for WCA. So they're trained very much in their way of doing things and their ethos. And they do have a constant need for more acupuncturists. Just working class acupuncture alone, this isn't the POCA member clinics, but just working class acupuncture. They've expanded from 1 clinic in 2002 to 5 clinics today. And among other things, they've had long-lasting partnerships with Care Oregon, which is one of, if not the largest Medicaid provider in Oregon, and CODA, which is one of Oregon's largest not-for-profit substance use treatment providers. So they've been able to use community acupuncture to reach these communities that otherwise would never have had it, and indeed organizations that would never have thought to use it. And they have given many, many treatments, over 50,000 last year, including the CODA treatments. ACMAC in the UK, this it's came along a little bit later than POCA. They weren't really connected with POCA at all. They started in 2007 with 5 member clinics. They're now up to 36 and counting. And again, POCA has many, many members, but ACMAC it's definitely community acupuncture and the popularity of this, what they call multi-bed acupuncture, is really growing in the UK as well. So their origins were more kind of local. There was a clinic called the Dragon Acupuncture Project doing community acupuncture in Brighton. The Gateway Clinic started by John Tyndall in one of the NHS hospitals in London, where he set up a community acupuncture clinic, as well as some observation and experience from one of the members from China. And there were some key influential figures there. Charlie Whitestone, who's the founder, and she's still very much involved today. John Tyndall, who founded the Gateway Clinic, and Peter Deadman, who has been a great supporter of community multi-bed acupuncture in its early years, and is the founder of the Journal of Chinese Medicine, and very well known in acupuncture circles, and particularly in the UK. A little bit about HIV/AIDS related work, as I mentioned earlier. Particularly this group, the AIDS Care Project. So this began in 1988 in the Back Bay neighborhood of Boston. And it came into existence because the New England School of Acupuncture, or NESA, got funding to offer treatments to people diagnosed with HIV. And this was at a time that nobody wanted to go near anyone diagnosed with HIV, let alone stick needles into them. But they wanted to do this, and they gained federal funding through 3 different administrations through the Ryan White Care Act. And basically, they were offering group community style acupuncture. They started out in the YWCA in Boston, and they had a large room for group style treatment. I think they spread to some other clinics as well, and eventually they developed contracts with hospitals, some prominent hospitals, although I believe they were doing individual acupuncture at the hospitals. And the AIDS Care Project no longer exists, sadly, but it did some really good work for quite a while. There's also the Pan-African Acupuncture Project, and this is an example of a global acupuncture project. There are several of them. This one began in Uganda in 2003, typically with these projects that use volunteer acupuncturists, in this case from the US. Also quite typical of these projects is it trains local community people, in this case healthcare providers, to do acupuncture. And so they've been specifically focused on things related to HIV, particularly also malaria, TB, and some other things. There are also disaster relief, international, global projects, and I'm naming just a few here, but we have Acupuncturists Without Borders, which is based in California, and they do work, for instance, recently with the fires in LA, they went to offer help there. So they work in the United States and also without the United States. There's Proyecto Salud y Acupuntura para el Pueblo, which is based in Puerto Rico. And for instance, they've gone to help people, local people, after Hurricane Maria a few years ago. There's the Integrative Health Project, which was set up by Joan Bocchino in New York, and they travel to South America, I believe. And World Medicine, which is based in the UK, and they have a program that takes volunteer acupuncturists to India. And again, they train local people there to do the acupuncture. And there are many, many other forms and uses of group acupuncture. Not all of them set out to have any kind of particular mission, except really to make more acupuncture available to more people. It's used a lot actually in cancer care. I know Memorial Sloan Kettering has or had a group clinic. They certainly did before COVID in New York, which people had to pay for, I believe. There's Maggie's, which is a charity which is associated with hospitals, but it's not part of the National Health Service in the UK. But among other things, Maggie offers group acupuncture. They just do auricular acupuncture for patients who are experiencing hot flashes, so mostly breast and prostate cancer patients. And that's free, and they can have 6 weeks of treatment. There's also the Gateway Clinic that I mentioned earlier, and the Guy's and St. Thomas Trust, which is NHS hospital in London, where they do group as well as individual acupuncture. Clive Whittam is an acupuncturist who I think I may have misspelled his name. I apologize if I did. But I recently met him at a conference, an ACMAT conference in the UK, and he has set up group acupuncture clinics in North Africa and currently Sri Lanka. And in Sri Lanka, again, they're training local people to do the acupuncture there. And there's also been quite a bit of research done into, not quite a bit, but there's been a fair amount of research done into auricular acupuncture and group acupuncture. Mandy Brass just published an article on, she's at the Guys and St. Thomas Trust in London, and just published an article on group versus individual acupuncture in that hospital, and found actually there was no significant difference in outcomes between the groups. And Beverly DeValois has also done a lot of research in that area. Haven't been keeping track of time, so I hope I've been doing okay on the time. But I know I've gone through the history kind of quickly, so if anybody is interested in reading about more about the early days, my book is Acupuncture's Revolution, and you can just put it into your favorite search engine and you'll be sure to find it. Just a few references here. It's just some great books. There's lots of great books on it. And thank you very much for listening. So I will stop sharing. And I'll look at questions. Okay, we're doing okay for time. So good. Okay, see how long is the event? That question got answered. How does acupuncture work at the spiritual level? Goodness, that's quite a question. It's, well, in Chinese medicine, emotion and the spirit are very much part of health and disease and illness. So we have what's called the, well, the emotional influences. I won't get too much into it, but so there are emotional evils, that they're called, that can lead to disease. Even excess joy can lead to disease. So when you're using acupuncture, you're so often treating the spirit, even when you're treating something relatively simple. So how does it work as a mechanism? That I don't think we have found out, but certainly there's a lot of evidence that it can increase calmness and lift mood and increase relaxation. So I would say all of those things affect the spirit. What is the training involved if you are a non-acupuncturist? Oh, well, it depends on the specific program. Usually it will be 2-3 days of training, I believe. And it's on-site training, so you would be there doing practical as well. I haven't looked at the specific ones really. NADA holds trainings, 5MP holds trainings, and you can look them up online and see the specifics. And they've got them in many different places because they keep training new trainers to do it. So those trainers can then give seminars. And I can only say that they last 2 or 3 days, and I think they cost somewhere between $300 and maybe $450. And I believe you have to do a certain number of hours to get, it's not a license, but just to be certified. How does acupuncture help in HIV and malaria? Well, it's really the symptoms. So it can't cure you of either one of those things, but it can help relieve the symptoms. And that's really it. So if you think of things, fatigue, diarrhea, pain, all of those things, acupuncture can be very helpful with. Thank you, everyone. What prompted me to do research in the area? Well, if I may say, what prompted me to do research in the area was I was applying for a fellowship, which I didn't get, but I was talking to someone on the phone, and they mentioned that they had studied at First World Acupuncture. And I said, oh, tell me more about that. And it kind of turned into where they've been interviewing me, and I started sort of interviewing them about it. And I hung up the phone and I thought, well, I don't know if I'll get this fellowship, but I think I'm going to write a book about this. And that's what happened. And it turns out there was kind of a, I don't know, the zeitgeist that a lot of people suddenly began looking at this same stuff. So there's a really great documentary called Dope is Death that came out. It was kind of paralleling my book as I was writing it. Ina Ming is doing really great research in the area. She's at Harvard. So yeah, there's a lot of stuff going What role does acupuncture play in current American federal policy where medical research and disability awareness? Ooh, well, happily or sadly, I don't know so much about that because I'm in the UK and I've just been hearing about what's going on there, but I don't know so much about what's happening with the research, except I imagine that if you are putting anything into your project, title, or application about disability or accessibility or marginalization or anything like that, you're not going to get federal grant money, is what I would imagine. Any places in Los Angeles that train for just community acupuncture? Yeah, as Oren says, no one does except Pocatec. So although there are acupuncture colleges that have community acupuncture clinics, and they might do that when I was at the PCOM in San Diego, we had on Fridays, there was a community acupuncture clinic. And we did have that free clinic that I was at, that was affiliated with the college. And it wasn't a community acupuncture clinic per se, but everyone was kind of in one area and there was a lot of communication going on. And I would have called that group acupuncture as well. But yeah, for specific training, Pocatec, they're the ones. And they're also a lot less expensive than most acupuncture colleges. Oh, thank you, Ashley. That's a lovely thing to say. Can you get a signed copy of the book? Well, if you want to send it to me, I'm happy to sign it and send it back. It's hard to do over Zoom, or I'd love to. But if you do want to send it to me, but I am in the UK, so it might not be worth it to you. Do I have a religious belief? I do. I'm Jewish. I'm not sure that Judaism has affected my acupuncture. I think it's more a sense of, certainly there are religious influences historically in acupuncture, Confucianism and Taoism, mostly among them. That's when there's just a lot of influences in the way that the body was seen and how it works in terms of Confucianism, and even the different organs have different names, like the liver is the general, and this is all sort of a Confucianist way of seeing the world. But of course, Chinese medicine has a really strong basis in Taoism as well. And Yosan University, where I studied in LA, that's a very Taoist institution. And we have a little Taoist shrine behind us. And I loved having that Taoist vibe there, although it's not part of my own religion. But I think that a lot of people who practice acupuncture feel affected by the spirit of it, even if it's not a religious practice. Oh, Anne, thank you. Yes, so Anne Lown was the one who I spoke to on the phone, who inspired me to do this research. So thank you so much for that, Anne. Oh yeah, I'll put in the chat. Oh, somebody put it, dope as death. Oh, Chris, wonderful. Thank you, Chris Montero. Yeah, it's a really great documentary. How is acupuncture research in the UK? I don't know about getting funding for it, but it's in a way easier to be able to do it. There's not so many restrictions on being able to do it, as long as you can find an organization which will grant you ethical approval. So if you can get ethical approval from a legitimate institution, it's pretty easy to go out and do it. But in terms of getting funding, not so sure. The British Acupuncture Council is actually very helpful in helping people to try to get involved in research. And what else? Can Pocatec train people? Yes, Pocatec trained people can legally needle people in any state as long as they have been licensed in that state, if that state has a license. So yes. Oh, thank you, Kelly. Oh, no, wait. Lisa said, can Pocatec train people legally needle people in California? Lisa said, unfortunately, no. So maybe I'm wrong about that. Oh, you don't meet in California. Gosh, I didn't know that. So, wow, live and learn. I guess acupuncture has its own board exams, which I would never pass if I have to take them again. So, oh, Hugo, I'm a current Yosan student. Yeah, Yosan's a great place. Great. Well, thank you, everyone. I think everyone saw the documentary is dope as death. And yeah. Is the 5-point needle? No, Miriam Lee. So Miriam Lee has a different, Miriam Lee's was not 5 points, but, and the 5-point needle protocol is in the ear. Miriam Lee's protocol was on the body, and she's got, the points are, gosh, I'm going to get it wrong now, but I think it's large intestine 11, lung 7, large intestine 4, maybe, liver, spleen 6. I don't think liver 3 is among them. Gosh, it's catching me out here. But no, those are different because those are body points. Stomach 36, of course. Thanks, Jess. How can I miss stomach 30? I fail my acupuncture exam. Yes. Oh, yeah. So Aaron's got a point about Qinghao Su. So artemisinin is the drug that's used to treat malaria. So yeah, so with Chinese herbal medicine, you can certainly treat malaria. And yes, they might use acupuncture with it. But I think the people who are traveling to do acupuncture in areas with malaria, they're not trying to cure it, but just trying to alleviate. Oh, great, Jamie. So you're doing your doctorate at 5 Branches. Wonderful. Yeah, that was, I did my undergrad in Santa Cruz. So Santa Cruz, great place.
Thank you so much, Rachel. I think this is the best turnout we've ever had for one of these talks. So clearly there's a great
I'm
amount of
honored.
interest.
Thank you, everyone.
Thanks everyone for being here. And yeah, folks can feel free to come on camera for a moment if you want to before you sign off.
Someone
In a
wanted to hear
minute.
the name of the documentary slowly. So it's called Dope is Death. DOPEISDEATH. And it's really good. Yeah.
Have a great afternoon, everybody. Thank you, Rachel.
Thank you. Thank you so much for inviting me.